I'm going to be talking today about how I compiled all of my concept maps to study for my NBCOP board exam, as well as to brush up on different information and topics we've learned over the past 2 years in preparation for my level 2 fieldwork rotations. I separated my information on different sheets within one concept map because this is how I learn information best. So I did different sheets based off different topics, and I tried to make them as detailed as possible to grasp the concept, but I wanted to leave them concise and comprehensive in the same sense of the word. So first I started with the frame of reference in OTPF and clinical reasoning, as this is the foundation of OT. And once I, study and learn these concepts to refresh my memory, I will have a better foundation for the rest of the topics that go more in depth. So first is the OTPF and the different domains, occupations, the OT process. And then we go over here to the different frames of reference. And so my fieldworks are a acute rotation at a hospital and then a pediatric school-based rotation. So I think definitely refreshing my memory on like the biomechanical frame of reference, the developmental, sensory processing. I think those are the types of frames of reference that will benefit me most while I'm on field work. But I do have them all here in one place now, so should I need to refer to more information, then I have it all in one spot here. So here's the developmental that I mentioned. I think EHP would also be really beneficial. NDT if I was maybe in a outpatient pediatric setting. OA, PEO. So I have them all listed here. And then we'll hop over to, here's our different clinical reasonings. So we have clinical reasoning and then we have critical reasoning. So our procedural, interactive, pragmatic, conditional, these are going to be our reasonings that we use on a day-to-day basis. And then we couple those with our critical reasonings, our inductive, deductive, analytical, inferential, and evaluative. Next, I have learning and teaching, and I'll start with learning. I put them both on the same sheet as I think they both go hand in hand, so I thought it was important to have that information together. So just broke it down. The model of learning, the memory, the information processing memory model, teaching clients, the stages of learning, and then we have teaching. And teaching our OT activities and the different phases of learning. Lots of information here, and even just in putting this comprehensive portfolio together, it was really good to refresh my memory. So then we go on to assessing cognition. And this one, I think this is very important. It doesn't matter if your client has some kind of cognitive impairment or dysfunction, you should always be assessing cognition. So I thought this was another really good review. So just going into our different areas here of cognition. So we have orientation, memory, and our executive abilities, our executive functions, self-awareness, and then we'll hop over here to our cognitive capacities and abilities, and then the process of cognitive assessment. So here's a couple of different assessments that I could use, and then if we're doing a self-report measure, what that looks like, and then how do I know that the results I got were effective, and then of course in the task and environment. So now we want to optimize our cognitive performance now that we've created a baseline with our assessments. So cognitive rehab, the concepts and methods to teaching and learning cognitive rehab. Our approaches. First, we have a skill task habit training, and then we have a strategy training, and then what all that encompasses. And then third, we have a task and environment modification, as I talked about, and then a stimulation theory, a process specific training, and then a lot of different strategies within all of those. So sufficient detail. And then how do we evaluate and treat a cognitive dysfunction? So zoom in and start over here. So we have things that the OT needs to consider. And again, as talked about, the models that will guide all of my assessment, treatment, eval, intervention. Managing the dysfunction. Here's an assessment, the Toglia. And then we just go into more detail over here, memory deficits that have an impact on daily function. And then here we have our stages of memory, which is also super important. I remember Dr. Chan talking a lot about memory and how you have to go through the different stages. Dr. Smith also talked about that a lot too, and how important that is, and our executive function and how it impacts daily function. So next we go to vision, and I think prior to OT school, I never truly had an appreciation for vision, but now knowing what low vision is and all of the different vision disorders, I have really taken an interest in vision. So this is something that's very interesting to me, and it doesn't matter what stage of life you're in. Vision is, or their lack of, is a very important thing to address with a client. And having impaired vision for my entire life, I know how important it is to be able to see and be equipped with the tools to make your, day-to-day tasks easier. So this is something that I really do want to focus on with my patients. So here we have the models of visual functioning, the populations and visual problems, as I talked about. It can be anyone who can have a vision problem or deficit, how you assess the vision, and all of the different things. Vision is a very, very detailed thing. Visual field, oculomotor functions. And then over here we have visual attention, which is also super important, especially like if you were working with a stroke patient. So next we'll go to optimizing vision. So now that we've addressed, we have a problem, here's how we fix it. And just going into the different diagnoses and low vision, as I just talked about, visual impairments, again, anything with a stroke over here potentially. And then how we evaluate and treat this. What is OT's role and the OT process with working with someone needing vision help? And again, a lot of overlap between these, but tying it all together is very important. And then we have assessing motor, planning, and performance. So this is also super important to assess in every patient, whether it's noted in their chart or not. Motor dysfunction. This is at like the cellular level, and the cortical, cerebellar, and basal ganglia, and our lesions that we learned about in neuro, the different models and approaches, and evaluation, neglect, apraxia, which is very important in your motor planning and the types of apraxia, and then how we optimize motor planning and performance and with neurological disorders. And then we've got different interventions, and then how we work with them, different modalities and interventions we can use. All very important stuff. I think this has really sufficient detail and some good photos. So then now we'll talk about sensation, and again, another area that I just fully did not have a complete understanding and respect for until I came to OT school. But now knowing and working with several clients who have sensation impairments, this is so important And now I've started seeing it within close family and friends, how they have sensation problems and how much it affects their daily life. So again, I've taken interest in this area as well. So, like I just talked about, the role of sensation in occupational function and how important that is from a neurophysiological foundation with sensation. Spinal cord injury, which we learned a lot about, how sensation is affected with that, and then how it comes back, if ever. Sensory recovery, the peripheral nerve injuries, evaluation and the OT process, how you record your assessment results. And then we'll go to evaluation of sensation, which again just goes into further detail. And I like this one. It has the homunculus here, which is super important, which is when I first looked at it, I had no idea what that was talking about, but now it makes complete sense to me. So just sensation testing, going more into the assessments we covered with Dr. Hay. And then lastly, the range of motion, strength, and endurance, which we will assess with every client, no matter what. This is the foundation if you're screening with OT. So the procedure, and like I just said, the screening, recording, interpreting your results. Are they having edema, pain? What's their muscle strength? What is their grasp and pinch strength? Their endurance. And then we break it down further here to the different aspects. And then how do we increase their range of motion, maintaining or preventing limitations in range of motion. So as you can see from all of these concept maps, this is a very comprehensive but yet concise review. And just from putting this together, I have learned so much, and I look forward to studying it more before I go on my level 2 rotations, and then reviewing it while on field work, and then reviewing it after as I prepare for my NBCOT board exam.